Hi guys, I'm Chloe, a registered dietitian. I just wanted to take a couple minutes to talk to you about the importance of nutrition after bariatric surgery. So right after surgery, your body's going to be spending a lot of time healing and adjusting to a new way of eating because you'll essentially have a whole different anatomy in your GI system. So you'll start with a clear liquid diet, and then you'll gradually progress to different stages like full liquid, pureed foods, soft textures, and then you'll start returning to regular food at like 6 weeks post-op. And following these stages really closely helps us make sure that your body's able to recover and heal, because again, your system is completely different now, and it really reduces the risk of complications after the surgery. So once you're back to eating solid foods, the most important thing you can remember, especially in the beginning, is the order of how you're eating your food. So generally, we want to have our protein first, then our non-starchy vegetables, and then our carbohydrates, complex carbohydrates, if there's still room. We need to make sure we're getting our protein first, because just because your stomach is smaller or just has a pouch doesn't mean we need less nutrients, right? It just means we're eating less. So it means we have to really prioritize and get a lot of quote unquote bang for our buck and making sure we're getting a lot of our essential nutrients, because we get full a lot faster. So starting with the protein and the non-starchy vegetables to make sure we're getting all of our vitamins and minerals is super important. And then we can have the complex carbohydrates after that. So it's not that carbohydrates are bad. They just want to come last because they digest quickly. They don't keep us full as long. And they don't have as many of the nutrients as we need. On the note of nutrients, we have to really make sure we're taking our supplements and sticking to that regimen. You'll not be able to meet your vitamin and mineral needs just through food, right? Again, because your anatomy is so different, your body's ability to digest and absorb all these nutrients is not as great as it was before. So we really have to take our supplements regularly. A big mistake I see people make, especially several years post-op, is going, it's all right, I don't need those supplements anymore. I had the surgery years ago. Nope, we got to take those forever. It just might change, with time, how much we need. But always ask your doctor. We have to usually take bariatric supplements, special ones that absorb a little bit easier. So some of the other mistakes I see are eating too fast, because you're going to get full really quickly. Skipping meals, because again, we got to make sure we get all of our nutrients in. Super important. Grazing, so not getting actual meals, just kind of snacking. And then not prioritizing protein, and then drinking water with the meals, especially in the beginning. You're going to get full really quickly in the beginning, and just in general, right? That's kind of the point of the surgery. So we need to make sure we have the water separate from the meals. But we do need to make sure we're prioritizing water. Hydration is hugely important. We've all heard eight glasses, 8-ounce glasses, the 64 ounces a day. That is kind of the bottom line for a lot of people, but it's going to change depending on your needs. And especially after surgery, again, we get full quickly. We're probably not going to be drinking quite enough water. So we have to make sure we're having lots and lots of water. Always ask your surgeon or another healthcare practitioner if you're not sure, because it's going to depend on you specifically how much water you should be drinking. But just make sure you have your water separate meals. So that's pretty much it. I think I covered all of the most important things. Thank you for watching, and just don't forget, good nutrition is kind of the key to feeling your best, healing, and making sure we really prioritize healthy weight loss.